Hello guys, welcome to Knowledge Bites. Guys, today I am going to teach you all about deviated nasal septum. Okay, but before starting deviated nasal septum, I want to tell you about the one line answer question. So the question is, what is the most common cause of septal deformity? The most common cause of septal deformity is deviated nasal septum. Now the question is, what is the most common cause of deviated nasal septum? So the answer is birth trauma. About 60% of the children are born with some degree of septal deviation. Okay. Now I want to tell you about the normal nasal cavity. This is the nasal septum. Nasal septum is dividing the nasal cavity in equal area. Okay, but now it may happen that, just look upon here, there are different types of deviated nasal septum. There are 5 types. So one is the anterior dislocation. You can see the nasal septum is deviated anteriorly. So this much of nasal cavity has more area and this much of nasal cavity have less area because of the anterior dislocation of the nasal septum. Okay, now if you look upon the turbinates, so the turbinate is very much swollen opposite to the deviated septum. Okay, now the second type of deviated nasal septum is C-shaped deformity. This is the C-shaped deformity. These all are the turbinates. Now the third type is S-shaped deformity. This is the S-shaped deformity. Now the fourth type is the spurs. The last type is the thickening of nasal septum. Thickening of nasal septum. The nasal septum is thickened or swollen. The nasal septum may be swollen due to organized hematoma or overriding of the dislocated septal fragments. Okay, now we will see the clinical features of the deviated nasal septum. Clinical feature of DNS, deviated nasal septum. So, nasal obstruction. Nasal obstruction is due to septal deviation and later it is due to hypertrophy of turbinate of opposite side. Second is the acute otitis media. Clinical feature of DNS: headache. All these can occur due to deviated nasal septum. Epistaxis, sinusitis, cosmetic defect, ethmoidal neuralgia, hyposmia. What is hyposmia? It is the decreased sense of smell. Now some patient has came to you and he is saying that he is having difficulty in breathing. Firstly you will check that is there any defect in the nasal septum. Now you find that there is some defect, so how will you investigate the DNS? Investigation. What will you investigate? In investigation we check for the nasal valve patency. The checking of the nasal valve patency is by Cottle's test. So now what is Cottle's test? So in this test the patient pulls the cheek upward and laterally. The patient pulls the cheek upward and laterally. By doing this the nasal obstruction is relieved. Okay, on obstruction of nasal valve area by DNS is confirmed. When you are pulling the cheek upward and laterally, the nasal obstruction is relieved. If nasal obstruction is relieved, then we can say that the patient is suffering from DNS. So it is an indication that correction of septum will relieve the obstruction. Now the management of deviated nasal septum. So the minor degree of septal deviation, we don't require any treatment, but if there is major degree of septal deviation and the clinical features are very much significant, then we do the surgical management. There is no medical management. So the surgical management are SMR, submucous resection of nasal septum, and the second surgical operation is septoplasty. Septoplasty is far much better than SMR. Okay, now we will see the differences between submucous resection of nasal septum and septoplasty. Okay, SMR is contraindicated in less than 17 years. Here it is not so. Okay, in SMR, mucoperichondrial and mucoperiosteal flap are raised from opposite side. Here in the septoplasty, mucoperichondrial and mucoperiosteal flap are raised from the same side. In SMR, there is more chances of complication. In septoplasty, less chances of complication. In SMR, reoperation is difficult. In septoplasty, reoperation is easy. In SMR, first incision which we give is the Killian's incision. In septoplasty, the first incision which we give is the Freir's incision. So from here we complete the deviated nasal septum. Thank you.